Welcome to On Call, Paging the Frontlines of the Future, a podcast powered by Project Unity. I'm Hargun Satcher, your host, and a proud member of Project Unity, a student-led initiative transforming how we talk about healthcare. At Project Unity, we believe meaningful health innovation begins by listening, not just to professionals, but to young people living and leading within today's health systems. This podcast brings youth into dialogue with experts across medicine, public health, and digital health to explore real stories, pressing challenges, and bold ideas, reshaping health equity in schools, clinics, and communities. Whether you're a student leader, an educator, or a healthcare professional, you're in the right place. This is where emerging voices and experienced minds come together to reimagine the future of health. Our guest today deeply embodies this mission. Bhav Jain is a medical student at Stanford University, a Knight-Hennessy Scholar, and the co-founder of the Social Equity Action Lab and Connected Foundation, organizations he started during his time in college and medical school that have mobilized hundreds of young people to improve health outcomes for vulnerable populations. Bob's leadership spans health equity, technology, and policy. His work has been recognized by NPR and the Clinton Global Initiative. He is passionate about leveraging storytelling, systems thinking, and youth driven innovation to close gaps in healthcare access and design more equitable systems. Bob, we're so excited to have you join us today. Welcome to On Call. Where are you joining us from?
Hi, I am here in Stanford on Stanford's main campus, and I'm very excited to be here. So thanks again, Hargun.
Awesome. Thank you so much. So let's start a little bit with your personal journey. Many people choose medicine because of one powerful experience. For you, was it a single spark or more of a gradual realization shaped by different chapters of your life?
I think that's an excellent question. For me, I feel as though I've always known I wanted to be involved in medicine, be a physician, but I'd say the specific nature of my interests has certainly evolved over the years. Ever since I was a young child, I recall having numerous encounters and exposures with the health care system, largely stemmed from both growing up with a very severe skin condition as well as a speech impediment. And so I had been in hospitals and doctors' offices ad nauseum for most of my early and adolescent life. And I think in that process, I just always admired how much empathy my physicians, my nurses, and other healthcare providers had, and how much help they were actually able to offer me with newest medical advances and scientific approaches. Um, and as time went on, though, and really kind of fast forwarding into end of high school, early college, seeing issues like certainly COVID happening, but even just hearing from neighbors, friends, and family about difficulty accessing the same sort of high quality healthcare that I always had access to as a child, I began to become more attuned to the broader social determinants and other upstream drivers which actually affect health access. And so that's kind of how I entered the broader public health space writ large, where I realized that I not only want my future imprint and work and engagement in healthcare to be focused on directly healing and providing care, obviously as important as that is. But I knew that I also wanted to help lead movements, help build movements with youth and others who are passionate about working through policy and system level change in order to actually improve the ways that we interface with the healthcare system at a national and global level. So in that sense, my specific interests within healthcare have constantly been shifting. And even now, as a third year medical student, I'm in the hospital most days. I recently wrapped up a month in the emergency department, and that was a very formative set of experiences for me as well. Because as much as we were able to save lives and help those who may have had heart attack or stroke or bone fracture, we also saw a number of patients who were simply coming in because they had nowhere else to go to refill their meds, or they had been sent out of the most recent homeless shelter that they had been staying in. And so seeing the ways in which our system, both our social safety net as well as our healthcare system, either is able to help or hurt different segments of the same population. That's sort of observation and realization is what has fueled my additional secondary interest in this broader area of public health.
Well, that's awesome. Thank you so much for sharing that personal story of yours as well. So, I wanted to just touch base on what you mentioned about leading the youth organizations. You founded the Connected Foundation and the Social Equity Action Lab while still a student. What inspired you to start these organizations, and what impact are you most proud of so?
That's an excellent question as well. I'll start with the Social Equity Action Lab, which is a more recent initiative that I had the opportunity to help launch and build since my first year of medical school. And really, the goal of that is to help engage youth in working on research and health policy efforts that will help to actually influence the way in which we deliver and operate our healthcare system. So, over the course of my undergraduate years, I was very, very fortunate to get to work on very interesting health policy and health and equities research, mostly in the oncology space, but also in other spaces in general medicine. And through that work, I learned how to use large national and global health databases in order to actually give health systems and policymakers tangible insights
Mhm.
oriented around where in their system are the inefficiencies most acute and which segments of the population are having the most difficulty accessing health care. Many of the same issues I was just now speaking about, but being able to statistically quantify the extent of these inequities then gives health systems and leaders tangible ways to make quality improvements. And so having gotten the chance to work with some really, really generous and remarkable mentors during my undergraduate years, yet hearing from so many others the challenges of actually accessing research as an undergraduate student, as well as the frustration that often our research does not necessarily translate into true health policy action. I started the Social Equity Action Lab with a colleague of mine. Through that, we have been teaching high school, undergraduate, and graduate students across the world actually on how to use large public health and healthcare databases in order to derive the same sort of insights about inequities that I had been doing for these last few years, as well as wanting to make sure that our research and our disparity work has tangible impact. Have been working with various local and state level electoral candidates to actually try and help them build out health policy platforms for their own election campaigns. And so over the last year we've gotten to actually work with two state level governor races on issues like Medicaid expansion, maternal and child health, substance use, and rural health, just helping bridge the gap between urban health and rural health, and really giving youth a platform and agency to do research that will make its way, hopefully, into bills of these future administrations. And then just briefly here, as for the other work with the Connected Foundation, so that was launched during the early stages, the peak really of COVID-19. And the idea of that was that I had, I had been sent home in my freshman year of undergrad, as had all of my friends that year. And was speaking with my grandmother who was living in India, and just learned from her that the effects of social isolation were extremely acute, that she was having substantial difficulty just adjusting to the lockdown. And as I spoke with other friends in the US, I had the same observation over and over again, that as much of a major public health urgency and crisis the actual infectious disease situation was, there was this impending threat of social isolation. And so I worked with about 500 high school and college age youth across the nation during lockdown to build this organization, the goal of which being that we wanted to try to bridge the mutual social isolation that youth and older adults were simultaneously experiencing. Just as a reference, even before COVID, about 40% of older adults were actually experiencing social isolation just based on the way that our social fabric usually operates. How older adults are often left at home or in assisted living uh, or in living sites. But really, it was during COVID that for the first time, youth on the order of 80 to 90% or more had similar experience of social isolation. And so we were finally able to understand and identify with what I would argue was a major public health issue that older adults had been going through for decades. So we began hosting weekly Zoom sessions with numerous nursing homes and assisted living facilities across the nation where we would actually host events and teach sessions on a range of issues ranging from history to international humanitarian law to jazz and modern American music, just interesting issues that appealed to both age groups. And I'll just end by noting that over the next several months, we kind of gradually expanded into other areas just by having conversations with older adults. We learned of other issues that they were going through, such as not actually understanding the full scope of their options and benefits that their own Medicare or Medicare Advantage health insurance plans offer them. Often they weren't aware of the other social safety net services and benefits that were offered to them as well. So we went from having this very singular focus on social isolation at first, which was obviously a very, very important focus, later on to having a broader focus on health and well-being for the older adult age group.
Well, that's incredible. Thank you so much for sharing that. And you bring up so many amazing points as well. I wanted to just highlight the fact that that's an incredible take you took on during the COVID-19 pandemic, that not just the disease was the thing affecting a lot of elderly patients as well. So that's really awesome. And I'm really glad you were able to learn so many different things by speaking to the elderly as well, and then utilize that in your work coming forward. So we'll move on into your design for equity. Your work shows a deep commitment to equity and the role of youth in shaping systems. You've built organizations that center youth voices. Why do you think that young people see problems in healthcare differently than professionals who have been in the system for decades?
I think even just looking at my own journey, both as a patient as well as a young person who is engaged in different health equity oriented movements, I feel that having grown up in a different era and generation automatically on its own gives us so much insight and context. I'll start with a very simple example of the work that I was just now speaking about back at the Connected Foundation, where we were trying to connect with older adults and other youth in a way that had not been done before. I think our experience growing up in some sense with technology, as many harms and ills as that obviously is also induced, gave us a very novel approach into how to forge social connection during COVID when otherwise social isolation, as I was speaking about, was a constant threat, was constantly looming. But we had been, even long before Zoom existed, we had been using FaceTime, we had been using Skype, other forms of video and phone engagement. And so we were actually very, very comfortable with all of that. That then gave us an avenue to think through how might we engage with older and other generations who may not have the same context as we do, and engage with them in a way that actually helps improve their health. And so I think that's just one example where it allowed us to think through a novel approach to engagement. One other approach that comes to mind. We haven't spoken about this yet in this session, but during COVID, I also was fortunate enough to join a team working on trying to build out an SMS-based triaging approach to help those living in unhoused shelters obtain access to free COVID tests. And so even that approach. It's an approach where we as youth had been, we're always on our phones, we're always texting others, and we know how simple and efficient texting can be if the messages are kept short and if it's very evident why it's being done. And so even though most forms of healthcare engagement in the system as it's built now happen on platforms like Epic, MyChart, maybe your doctor's office will give you a physical phone call. Those aren't inherently scalable ways to reach these sort of vulnerable, unhoused populations that we were very interested in reaching. But by using SMS lets you automate and mass shoot out messages to a whole host of people, and virtually everyone these days has at least a basic phone, if not even a smartphone. So that's just one more example of how being a younger person growing up in the era of technology, I think gives us a huge advantage. And then I'll just end on more of a note around empathy. I think that as youth, we haven't yet been exposed to the high pressure, high pace corporate environment that many of our parents and others are constantly immersed in. And so we have the time to actually speak with others, understand the issues and challenges that they are facing, and then orient and design solutions around that. Right. And so I think, much of the work that I was doing with the Connected Foundation really involved us speaking with hundreds of older adults across more than 20 states, trying to understand what were their main pain points and challenges that they were going through during the first lockdown and peak of COVID. What sort of youth based solutions might they be interested in? Are they even interested in engaging with us as youth? The answer was yes. And I think we have a uniquely empathetic approach to speaking with people, unique interest in learning from people who have far more years and experience under their belt, which then lets us more quickly and efficiently understand the pain points that I think for so long the healthcare system has ignored or not been aware of, just because it has to operate at the scale and speed that it does when it's being run by people who have been in the industry for so long. And so I think while expertise obviously brings with it a whole host of merits, there is simultaneously, in my opinion, merit in actually having a naive view, not knowing anything about a system or an issue at hand, and then uh, in doing so, forcing yourself to learn as much as you can about it from the people who are directly affected by the system as it exists as of now.
Absolutely. Well, thank you so much for sharing. And you actually touched base on the next question that I had had. You talked a little bit about having a naive view and having it be kind of beneficial in leveraging the future and really seeing healthcare through a different lens. So, in your view, what is the biggest blind spot in how current leaders talk about health equity?
Well, I'll start off by saying that I am very, very pleased with how much health equity has become a forefront focus for several major healthcare systems. I think much of it happened during and in the aftermath of COVID, just seeing the substantial inequities that were happening in that era. We saw obviously Black patients and other racial minority groups having significantly worse outcomes, both in reaching the hospital and once they were in the hospital for COVID. And so I think naturally equity, as much of an issue as inequities have always been in our system, was certainly pronounced in that era. And I think health systems did pay more and more attention. I think as for where gaps still are, I feel that we still don't do a sufficiently adequate job of trying to design solutions that will work for people who are affected by these inequities. We are very we're seeing health systems very, very interested in building solutions that address many of the upstream social drivers and social determinants.
Mhm.
Much of this has been done through having entire health equity teams that hospitals or health systems or health insurers will actually appoint. But having gone on the ground speaking with people living in homeless shelters, living in the global health landscape where there are still, you know, just as an example, slums and other highly congregated areas in India and other low and middle income countries. Speaking with these groups, you can't help but feel a sense that they still feel unheard, that they, it's great that there's a new app or a new Epic slash MyChart feature that their health system is offering. But if they don't have the benefit or the advantage of the health literacy needed to actually understand, how do you schedule an appointment on this app? How do you check your results? How do you engage in good follow up with your outpatient PCP? Then many of the same technological advancements that I was speaking about in my last answers are moot. So I think the next big focus that I would personally like to see from health systems is trying to work directly with the populations affected by inequities, really empower them with the health literacy needed to then engage more meaningfully in healthcare as it's operating now. And I think with that, we will really expect to see much more uptake of healthcare services from these groups. In fact, much of my earlier research looked exactly at this issue of how much healthcare services do marginalized or vulnerable populations take up, even if they have full access, even if it's at no cost at all. And we still saw that based on race, based on language, based on physician patient racial concordance, that there were substantial inequities. So really thinking through, how do we improve uptake with all the advancements that we've already made?
Absolutely. Yeah. And this is honestly something that I've seen myself as well as an undergraduate pre med student right now, doing research and doing work with elderly patients. It's often really hard for them to have health literacy, and they're not really aware of all the technological things that are going on during the current time. So, absolutely. Now we'll focus a little bit more on your leadership. You've been on the front lines of building organizations and now part of major institutions like Stanford. Many of your initiatives started as ideas in high school or college. So, what helped you turn these ideas into real, long lasting organizations instead of just projects that faded away?
I think that's a really important question, because so often as youth, it's easy to want to build something, launch something. As I was speaking about, we often see issues in a different, unique way. But if it's not kept sustenant, then the effect can be relatively diminished. And so I think for me, the biggest lesson I've learned with all these efforts, some have been obviously more or less successful than others, but the same consistent theme has been working in large groups that are um, all similarly passionate about the issue at hand, because that's the only way that you scale. Nothing that I've ever worked on has been my effort alone. It's always been with, usually hundreds, if not thousands others. And so, having a core team that's able to really lead out and implement much of the ideas that you have, and then making it a mass movement, right? And I think this speaks to this notion of grassroots led movements, that those, especially for an issue like healthcare or health inequity, where you're really trying to target a group that for so long has been ignored or otherwise neglected. I think it's important to approach these movements from a grassroots standpoint, where you actually try to engage and involve the very people who are affected in the design
Mhm.
of the organization's work. And so even when we were working on the Connected Foundation, we actually had seniors and older adults involved on our board and involved in our design thinking sessions around how, like, what are the issues that you actually see yourself and your peers facing? How can we help bridge that gap? Or when I was working on the SMS based triaging approach for COVID-19 testing, even then we actually spoke first with people living in the unhoused shelters. With this new work now on the social equity action lab, we have several high school and undergrads who work with us on research, and we ask them, like, what are the areas of impact that you want to make, and how can we help support it? So I think both being willing to work in a grassroots large team type manner, as well as approaching things from a servant leadership standpoint, where you lead in a way that seeks to serve others and uplift others rather than trying to, adopt the standard corporate approach of hierarchical and delegating type leadership. That often does, in my experience, does not work very well for these movements where it's really based out of heart and soul rather than out of a specific business or corporate target per se.
100%. Well, thank you for sharing that takeaway. I think that's an incredible point to work in large organizations and work with people who do have the same passions that you do and are willing to put in that time and effort to really keep your project sustainable. And we can see that they've had grand effects as well, and you've been able to do that. So that's incredible. From your perspective, what are the most important values for young professionals entering healthcare today?
But I would say that based on what the sort of trends are going to be in our healthcare system going forward, there's obviously AI, which is set to really revolutionize much of how we think of and approach healthcare delivery. I
Mhm,
think it's very important for young people, to be again willing to have these difficult but often meaningful conversations, like having that sort of inquisitive investigatory mindset of I don't know much about an issue, but I'll seek to learn as much of it as I can from others who have expertise or lived experiences. So that's one. In other words, approaching issues with a sense of humility and an acknowledgement of the naivete from which we are actually operating. And then the other is being able to think at a system level and see problems as complex systems or networks with multiple different elements. I think that, as I was just now saying, with AI, so much of how we approach healthcare is going to change. Much of the information that we have for a long time had to memorize is going to be different. And I think the approach will in some ways be less on the objective medicine itself per se, and more on these broader issues like how do you expand access, how do you actually reach the precise populations that we've never or almost never been able to
mhm.
reach. How do we improve the efficiency? How do we lower the actual spending of our healthcare system? I think these are increasingly going to be the questions that all physicians of the future are having to battle. And I think the only way that you start to answer those questions is by looking at things from that higher level, fourth or fifth order perspective, where you are seeing it as a full system and you're able to understand which inputs or outputs of that system are worth intervening on now versus which ones maybe warrant intervention at a subsequent point. So I think that system approach, as important as it's always been, will be even more important going forward.
Okay, awesome. Thank you. And as we look into the future, if you could redesign one part of the US healthcare system from scratch, where would you start and why?
As cliche of an answer that this would be, I do think that our health insurance landscape has been one of the biggest barriers to progress and access in our healthcare system. This is obviously a debate that extends back several decades now at this point, but I do think having a universal health coverage option would have done much to really ameliorate these inequities and challenges that we have all spent so much time focusing on. And that while I obviously do believe in a role of business and of the corporate sector to engage in our healthcare system, because that's how you also keep advancement and innovation happening. We're seeing now that nearly $1 trillion, has been cut from state Medicaid budgets across the nation. Seeing SNAP and food assistance and housing shelter assistance programs also being cut. And so with all of that, when we're both cutting our social safety net as well as not guaranteeing health coverage for all Americans, that only produces a population that has more underlying disease, more underlying comorbidity. And so it makes it very challenging for healthcare professionals to actually treat and manage disease and focus on all the other system level issues I've been speaking about when the system itself is built in a very perverse or adverse way. So really it would have to go back to universal coverage with access.
Okay, awesome. Thank you for sharing that. And then just a few reflection questions before we close. What's something you may have unlearned about healthcare leadership or reevaluated about healthcare or leadership in the past?
I think for me, the focus has really always been on trying to approach issues from the perspective of I don't have much expertise, much context, but also for a long time, what I would do is I would then approach people who only have expertise
Mhm.
in a given area of interest to seek their feedback, iterate on a given product or research question with them. It has always been a valuable process, but I think it was only relatively recently, still in my journey, where I began approaching others who also have no expertise or relatively minimal expertise. Because there is actually, I think, merit to speaking with those people as well who may approach and see issues in a vastly different light from what the people who have expertise or people who are very entrenched in academic or corporate interests. While they have expertise, they may not offer the most unbiased or most on the ground type perspective. So thinking through this notion that expertise is not a necessary requisite to be able to speak meaningfully on an issue. Most, arguably most patients, myself included, have very minimal expertise on the medicine itself that they might be receiving, but they may have inordinately more expertise than us in the healthcare system on what are the barriers that they are going through just in order to reach the hospital. So thinking through, in other words, maybe the better way of framing it is expertise is really a multi-dimensional construct, and one can have expertise in one area that is often seen by the public. Others may have expertise in less publicly known dimensions, yet that dimension is actually more important for the issue that you are trying to solve.
Absolutely. Thank you. Before we wrap up, is there a final message you'd like to share with young people passionate about transforming healthcare? What advice would you give to someone looking to break into healthcare and make a difference? And anything that you wish you knew when you were younger?
For me, the one insight that I've learned over the years, over and over again, has been really viewing ourselves as youth as having a unique, in some sense, a unique competitive advantage. People always want to hear from youth more. And I find that actually we as youth often view ourselves in a less elevated light than what we should. We view ourselves, as I was just saying, as having relatively less expertise. But as I've also spoken about over this interview, that means that we see issues in such a remarkably novel way that is necessary for the stakeholders who have expertise to know about. So being not being afraid to actually put ourselves out there, engage with the stakeholders who run our system, and try and work with them to find ways to improve the way things stand for everyone. I remember back in high school, I would reach out to hundreds of university professors asking for research opportunities, and
Great.
very few. I think out of hundreds, only one or two actually got back. But so that made me feel as if there isn't much interest in youth. But as I worked with the one or two that actually did take a shot on me, and I then started college after that point, I saw that more and more were willing to give me a chance as they realized in increasing numbers that there is actually much benefit to working with youth, that through my working with them, they had also gained out of it. I had obviously gained out of it. So really, I think that's been the number one. And then just very briefly, what that has now led to is these large youth movements where we feel so empowered to actually make change, and lead in a truly servant kind of unique way relative to how things have been thus far. So definitely put yourself out there and know that you as a young person have immense value to add, even in an issue or a system as nebulous and complex as healthcare is.
Absolutely. Thank you so much. And then just a fun question. What question would you like to leave for our next guest? It could be a healthcare professional or youth leader, but anything in specific you wanted to ask.
Yeah, no, this is great. I would love to hear from the next guest. What makes them most excited about youth? Have they had any interactions with youth that have changed the way that they think about problem solving overall?
Awesome. Thank you. And then thank you, Bob, so much for sharing your journey with us and showing us what it means to lead with vision, equity, and purpose. We hope today's conversation sparked reflection and affirmed that youth voices and mentors are essential to building a more just and responsive health system. If you're ready to take that next step, visit projectunity.org to connect with changemakers, explore student led initiatives, or get involved with future episodes. I'm Hargun Satchar, and on behalf of Project Unity, thank you for listening. See you next time on On Call.